is Vidya Verma. She has not come. Vidya Verma. We'll start with the second one. Dr. Arnav Mandal.
Hello. Shall I start? Yes. Good morning, everyone. I'm Dr. Arnav Mandal. Today I'm going to present on pedunculated capillary conjunctival hemangioma case report. Capillary hemangioma is a common benign tumor of the eyelid in children, though less common in orbit and uncommon in conjunctiva. It may be superficial or deep lesion. The lesion blanches on pressure and swells on crying. Histologically, it's composed of dilated capillaries, lobules of polyphytic endothelial cells separated by fibrous septa. Conjunctival capillary hemangioma are usually benign and unilateral on bulbar conjunctiva, though palpebral conjunctival hemangioma was reported. Treatment depends on the size and extent of the lesion. It may be conservative or surgical. Conservative treatment consists of beta blockers, interstitial steroids, cryotherapy, radiotherapy. Surgical intervention is needed if it causes mechanical ptosis, astigmatism, amblyopia, and it ulcerates, bleeds on touch, and gradually increases in size. In our case report, 11 years old male presented with pedunculated conjunctival mass in the left eye for 2 months, which was insidious onset, gradually increasing in size and painless. The surface of the lesion becomes ulcerated over the period of time and bleeds on touch. He also complained of redness, watering, discharge in the left eye for the same duration. Visual locate 6/6 in the both eye, and anterior segment of the left eye shows conjunctival hyperemial lacrimation and discharge. A mass was noted arising from the bulbar conjunctiva lateral to the temporal limbus, the left eye, which was 10 × 8 × 5 mm in size. Erythematous pedunculated, firm, mobile, bleeds on touch, non-pulsating ulcers, and surface ulceration. And patient underwent surgical excision under local anesthesia with 2 mm clear margin. The excised mass was sent for histopathological examination. On microscopic examination, the section showed nodular bit of tissue having surface ulceration, occasionally covered with squamous epithelium, and the lobular proliferation of the thin wall capillaries with plump of endothelial cells. And the morphological features consist of lobular capillary hemangioma. And this one the pre-operative and this the post-operative pictures. Discussion. Hemangioma is a hematoma that is developmental malformation of the blood vessels, and usually course is rapid growth over weeks to months and followed by spontaneous slow spontaneous involution over months to years, and prognosis is really good. In our case, the child is presented with rapidly growing mass, pedunculated mass over conjunctiva left eye, which was associated with watering and discharge. The lesion was surgically excised to relieve the child both symptomatically and cosmetically, and the patient was asymptomatic on postoperative day 1 to 6 months follow-ups. On conclusion, the pedunculated hemangioma from the bulbar conjunctiva should be excised if it causes symptoms like watering, discharge, and cosmetic problems. Thank you. Yes.
Very well documented case. I would like to suggest that you should have done immunohistochemistry too with this picture, so
Yes,
you can
sir.
prove that it is capillary hemangioma, because these are the rare presentations of the pedunculated part. The pedunculated tumors are rare, is a rare presentation.
Yes, sir.
Yeah,
Thank you, sir.
good case. Yeah, Dr. Shivali, she isn't there. Dr. Navdeep Kaur.
Good morning, everyone. Today I'm here to talk about early complete regression of medium-sized choroidal melanomas after iodine-125 plaque brachytherapy. Choroidal melanoma in Asian countries is a rarity with incidence of 0.2 to 0.6 per million population. Plaque brachytherapy is the gold standard treatment for choroidal melanoma. But due to lack of awareness, delayed presentation and relatively bigger sized choroidal melanomas are seen in our country. Iodine-125, due to its deeper penetration of gamma rays, is the preferred isotope for brachytherapy in India. Variable regression patterns of choroidal melanoma are seen from more or less rapid decrease through no change or to even an increase in thickness. But a regression to a flat scar is a rarity. Review of literature revealed a single case report of regression of choroidal melanoma to a flat scar after combination treatment with PDT and ruthenium brachytherapy. We aim to report 3 cases of medium-sized choroidal melanoma treated with iodine-125 plaque brachytherapy that showed rapid regression to a flat scar in less than 12 months of duration. It is a retrospective case series of 3 patients of medium-sized choroidal melanoma, which included 2 male patients and 1 female, presenting features of all were decrease in vision, which range from PL positive, hand motion close to face, and finger counting close to face. The tumor characteristics were volume ranging from 400 to 974, and tumor thickness ranging from 4.2 mm to 5.7. Now, case 1 is of a 20-year-old male who presented with a vision of finger counting close to face and was diagnosed to have an inferonasal choroidal melanoma with retinal detachment. 9 months after post-brachytherapy, his vision gained to 20 by 100, and there was regression of choroidal melanoma to a flat scar, and the RD also reduced. Now, second case is a 78-year-old male who had a vision of perception of light only and was diagnosed to have a juxtapapillary nasal choroidal hemangioma, which also reduced to a flat scar 9 months after brachytherapy, but vision remained PL positive only. Case 3 is of a 45-year-old female who had vitreous hemorrhage in right eye. Her vision was hand motion close to face, but diagnosed to have choroidal hemangioma as per USG-B scan and MRI scans. 6 months after brachytherapy and pars plana vitrectomy, her vision gained to 20 by 60 and the lesion regressed to a flat scar. Now, the predictors of regression in choroidal melanoma are tumor thickness, largest basal diameter, ciliary body involvement, TNM staging, tumor shape, radiation dose to tumor base. Initial tumor thickness remains the predominant and robust predictor of tumor regression. The reported decrease in size of choroidal melanoma is 43 to 44% by Rashid et al. And Maheshwari et al. Respectively at 3 years after brachytherapy with the use of ruthenium, iodine, and palladium brachytherapy. But in our case, 3 patients of medium-sized choroidal melanoma reduced to a flat scar with the use of Oculoplasta seeds of 125 iodine. Till now, no study has shown such dramatic response of plaque brachytherapy in melanoma. Okay, now to conclude, Oculoplasta seeds 125 can give a remarkable regression of choroidal melanoma to a flat chorioretinal scar. Good visual outcome after brachytherapy can be expected in less than 12 months of treatment, but histopathological examination may have added to a better understanding on the tumors which regress rapidly. Thank you.
Very nicely presented, Navdeep. So we have next, thank you. We have next presenter as Nishtha Mishra. She's not here. Praveen Khuntia. Dr. Praveen. Next, Dr. Tilottama. I think time limit has been set here as 5 minutes. You have to set to 3 minutes.
Good morning, everyone. My topic is on salivary gland choristoma, presenting as an epibulbar mass in a case of golden heart syndrome. So what is golden heart syndrome? It is a rare congenital disease due to abnormal development of the first and second branchial arches. It is usually characterized by a classical triad of mandibular hyperplasia and facial asymmetry, ocular and auricular malformations, and vertebral anomalies. These are the various ocular manifestations, the most common being epibulbar choristoma or a subconjunctival dermoid. Choristomas are benign congenital lesions composed of mature tissue elements in an abnormal location. The hallmark of golden heart syndrome, the ocular feature, is the presence of an eccentric or limbal epibulbar choristoma, the most common location being infratemporal. So, a 2-year-old female child presented with a swelling which was non-progressive in nature in the right eye since birth. The right eye showed presence of an epibulbar mass covering the inferior and temporal part of conjunctiva and a part of cornea. General physical examination of the child showed presence of preauricular tags, preauricular sinus, dental malocclusion, and club foot. The mass involved superficial cornea. There were presence of fine hairs on the surface. Surgical excision of the mass was done and amniotic membrane graft was sutured over the bare area and bandage contact lens was placed over the cornea. The tissue bed was sent for histopathological examination. Microscopic examination revealed multiple tissue pieces lined by keratinized squamous epithelium, and dermis showed presence of hair follicles and fibroadipose tissue. Magnified examination of one bit of tissue showed cuboidal epithelium lining the subepithelial lymphoid aggregates and lobules and acini of minor salivary glands. Histopathological examination was suggestive of salivary gland choristoma. There was no evidence of atypia or malignancy. The child was given a refractive correction of plus 4.5 diopter spherical in right eye 1 month after surgery. So such ocular tumors usually present with consequences like induced astigmatism, amblyopia and strabismus. So early diagnosis, surgical excision of these lesions and appropriate refractive correction will prevent complications like amblyopia and strabismus, especially in pediatric age group. Golden hair syndrome needs a multidisciplinary approach and long-term treatment. Histopathological study is important to confirm diagnosis and rule out malignant lesions in case of an epibulbar mass. The prognosis of this condition is usually good in patients with no systemic complications. So these are my references. Thank you.
Nicely present.
Thank you, sir.
Someone else is to present in this first session? Okay, thank you.
Yeah. Dr. Parul, please start.
Good morning. I'm presenting comparative study of outcome of ROCM associated COVID-19 patient. ROCM is a life-threatening disease caused by zygomacatic fungi. It have exploded in India during second wave of COVID-19. At that time, prevalence was globally 0.005 per million and in India 0.14 per thousand population. It is believed that COVID-19 virus damaged the pancreatic cells that produce new onset hyperglycemia, making pre-existing diabetic mellitus worsen. Post-COVID-19 immunosuppression, hypoxia, acidic media, and use of steroid make favorable condition to contract ROCM. Our aim is to evaluate factor associated with the occurrence of ROCM in COVID-19 patient and compare its outcome between global salvage versus exenteration group. This is an ambidextrous study. We retrospectively review the medical record of all RT-PCR positive patients, and further we prospectively did subjective and objective assessment of all ROCM patients. The demographic data, treatment history, comorbidities, duration from the onset of symptom, and clinical findings were studied between two groups, ROCM in active patient and ROCM in recovered COVID-19 patient. Then management and outcome were given. Outcome was studied in two groups, global salvage and global exenteration group. For further ROCM progression, regression, or mortality. The picture showing ROCM associated COVID-19 patient with third nerve palsy. Below it is conjunctival chemosis with proptosis. This is MRI showing right retrobulbar fat straddling with thickening of extraocular muscle. We found ROCM in recovered patient was higher as compared to the active patient. And the risk of developing hyperglycemia in recovered patient was 0.82 times higher than the subjects with active COVID. Exenteration was done in severe case who had stage 4 ROCM. However, even after exenteration, ROCM progression and mortality was observed in 17.14 eyes. We found risk of mortality as higher in exenteration group. Our conclusion is orbital exenteration did not significantly beneficial in advanced disease, and hyperglycemia was the major predisposing factor. Unjudicial use of steroid was a preventable factor for the better prognosis. Thank you.
Hello. Yeah. So how many cases were there in your hospital during that mucormycosis time?
COVID patient
Okay, and in the globe salvage group, did you give the retrobulbar amphotericin? Or what all did you do in the globe salvage group?
Group salvage group, we only give the retrobal amphotericin, and
Yeah.
group another is exentation. We just
Okay.
compare them, which is
You
better.
compared the mortality or the
Compare the
progression?
mortality and progression both.
Okay, okay, okay. Thank you.